Okay, we can get started here. So welcome everyone. My name is Vincent Medley. I and welcome to I am the Maddie's Director of Human Animal Support Services. So tonight's webinar, I want to just set the stage that it's a really sensitive subject. And anytime you're talking about life-saving rate or live release rate, all of us probably have been on the negative and positive side of that. You take somebody like me who started out in the early 2000s at shelters where we were basically high kill shelters, and I was one of the people responsible for that. You know, you realize that you know there's some things that we may talk about today that might be triggering. And for me, when I was working in those in a shelter of that type, um, I was triggered by conversations, and so we understand for a long time, and so there's no judgment here at all. And what I'd ask for you to do is, first, hear our panelists out, myself as well, and we really want to have a conversation that takes us beyond what we already know works within the shelter, but then also something that expands beyond that. So we're not asking anybody to change their mind. We just want you to open your mind and be open to the possibilities that can be created with a group of people with an open mind. We know that this is all about the work that you all are doing every day, and our commitment is to be involved in any way you want us to be involved. So nobody wants to euthanize, and we all want our animals to be adopted. And I think one of the things we can do is have a conversation, and that will take us, hopefully, give us the possibility of having a day where we no longer have to have this conversation. All right, now let me introduce our panel. Um, Tonight's panel, Beyond the Save Rate, um, integrating people in the sheltering equation. We will have the opportunity to speak to the industry famous Dr. Ellen Jefferson and the up and coming famous Cole Wakefield. Um, and I'll just give the floor over to the two of them. If the two of you could just start out by introducing yourselves.
Sure. I'm Ellen Jefferson. I'm a veterinarian and the president and CEO of Austin Pets Alive and American Pets Alive. And I'm really excited to be here. This is a topic that's near and dear to my heart, and I think is, as Vincent said, it tends to be very controversial, but I think it's something that if we lean into, we can get to the other side and start having more productive conversations. So I'm excited to be here.
And
And
I'm
Cole.
Cole Wakefield, Executive Director of Good Shepherd Humane Society in Eureka Springs, Arkansas. We're a small rural humane society. And a lot of my work and writing is around rural work, but also the broader industry topics, which I enjoy engaging in the conversation and having these sort of thought talks about. So this is exciting.
Yeah, and thank you both for being here. I so appreciate you being part of this, and bringing this message to our audience. So, Dr. Jefferson, we'll start with you. You had a recent article in Psychology Today, and that's what really inspired this webinar. Can you share why you felt like that was an important topic for us to address now?
Yeah, I think, and particularly regarding Psychology Today, it's a topic that is coming up more and more because after COVID, where shelters have filled back up, and many shelters are seeing a reduction in adoptions that they had even before the pandemic. and getting higher and higher intake. And so we're seeing the kennels and the shelters over full, and it leads to a tremendous amount of stress on team members and and even on policymakers and on the public with scrutiny, and it causes a lot of distress. And what I see happening is that we don't have a lot of ways to talk about that the population of animals and how they get in and out. And but as an industry, we have embraced the 90% across the board mostly. I think that anyway, well, we can talk about that later. But as one of the only metrics that are out there, and it's signifying life and death, that's pretty much the only lever we can pull when we get over full and we get really crowded is euthanasia. And so we see euthanasia numbers go up, and I think it's a direct correlation to us not being able to articulate better how to measure other important things that are going on in the shelter and outside the shelter.
And we know that 90% number, the save rate, or 90% live release rate, that's become the gold standard for most in animal welfare. Why is that metric? Why has that become so crucial? I'll start with that first question, and then I have a second follow-up one.
Cole, do you want to take that?
Yeah, I mean, I think the save rate, I mean, it's been absolutely, that number has been incredible as an awareness builder for us. It's been amazing. It's this really sort of simple number that's really compelling. It's, it's life and death. And that attention that it was able to bring to what was going on in animal shelters has been very valuable. I mean, prior to really the no-kill movement and trying to really focus on shelter killing, there wasn't a lot of attention being paid at all, which is why these, animal shelters and this entire sector was sort of just languishing. So it's powerful, and it has demonstrated it's powerful in what it has brought and the change that it has helped bring to the industry. But and that's why it has become crucial. I mean, I think that it's simple, it's easy to communicate. And it's serious because it's life and death. And, it's hard to come up with something that's that simple and compelling to compete with that statistics, and it has served us well. But when it comes down to it, we're still the most underfunded public service in almost every jurisdiction that you go to, if we have any funding at all. So even though we have made great strides with this, with this 90% and focusing on that and bringing that attention, and it has made some major institutional and structural changes inside animal shelters, when it comes down to the broader picture and the bigger system, we're still, receiving a fraction of the funds of almost every other public service, especially ones that reach the number of households that we do. And what I think the reason that is that we put save rate as this sort of sanctified metric, and because it centers the animals. And for those of us who work in this, that's important. Like, we center the animals in our work. A lot of us are here because we value that and we want to serve that, as are the people who support us. But the people that we need support from the most right now, which is our public officials and the people who have the budgets and make policies, they're not in that job for the animals. So if we come at them with nothing but animal focused statistics, we're automatically the lower priority when it comes to setting policy and funding priorities. So we have to find ways to measure our impact so that we can broaden the conversation and start getting the resources that we need. And we have to be able to frame our impact on communities and people to get the attention that we deserve from public policymakers. And that's just one thing.
Thank you. And yeah, I mean, that 90% was a very big motivator, especially for I can speak for with having that strong animal control background of agencies that had a really heavy enforcement background. It forced us to expand and to think outside of just enforcement and picking animals up. And it was like, okay, now that you have them, what are you going to do with them? It's your responsibility now. And so we can talk more about where Haas fits in that evolution later on in our discussion. But yeah, that 90% was a very, very heavy motivator for a lot of shelters around the country. The second part of my question is, what implication does the 90% save rate have on the public perception of the sheltering operations? And I think you touched a little bit on it, Cole, but I don't know, didn't know if you wanted to expand, or Dr. J, if you wanted to expand as well.
Yeah, I don't mind diving into that. I think it's a critical measurement for public perception in particular. We're all in it. We all are immersed in the work, and I don't think we really have a good understanding of how hard it is for the public to see what we do, and how we value the animals that are in our care. And so I think that it is a barometer of sorts that allows the public to have some intel on what's going on in the shelter. And so you can have really amazing marketing and be doing a terrible job in the shelter, or you can be doing an amazing job in the shelter and have no marketing. And people, either way, people are not going to be happy. And so this is a data-driven approach to trying to just help people understand what you're trying to achieve, or what you have achieved in terms of taking care of the animals that are coming through your shelter. However, I think that it's a really it's a big problem, because it's a, and I'm hoping this isn't too much of a veterinary analogy, but it's a blunt instrument. And when you have a blunt instrument, all you can do is kind of hack at something. You can't actually have a finely tuned response or finely tuned surgery. And so it's it's better than nothing, blunt instrument, but it's not finely tuned. And when we hear the public outcry about deaths in shelters, it helps, but it doesn't truly get at what people want. And what we with Haas in particular, we've done a ton of community values surveying across the country. And what we're seeing is people really do care about what happens to each individual animal that comes through the shelter. And we need to get more fine-tuned in what we're doing. And to Cole's point, how does that turn into the public actually helping us achieve those goals, rather than just a report card that we're giving to the public about what is happening inside the shelter? And so I think that we have an opportunity to leverage it, and to really to think about how we can help the public be more on our side, I guess, is what I'm trying to get at.
Yeah, that public messaging is so important, and how the public sees us outside of just the work we're doing inside the shelter. What challenges arise from trying to tackle human problems that are impacting pets, especially in institutions with limited resources? You want to start us off, Cole?
Yeah. Yeah, I mean, it's the the challenge there. I mean, so we know we need to focus more on people. We know we need to focus more on what's happening outside the shelter to really address causal issues. But the problem is that sheltering itself is very time consuming, resource intensive. And in most places, we still need animal shelters. We still need shelters. They are providing a vital safety net service. So if you're doing a shelter, you have to do it right. I mean, I think that, if we're promoting people to do sheltering, it's important that you maintain capacity for care. You do all of these things that make sure that you're having a safe and effective, healthy shelter. So it can be really hard. Like, it is hard for my organization to find additional resources to start doing that community work, because we can't just stop sheltering and take all that money that we're using in sheltering and start focusing on the community. But we've gone and we're really scraping, and we're trying to do it because we have to get out there and do it. We have to find the resources. We have to shift the resources, or we have to go convince the our policymakers to release the resources to us, because if we don't find the resource and we don't find a way to move our work even heavier into neighborhoods and into communities, then yeah, we'll still be talking about this in 20 years. We'll have a 20th anniversary conversation, because we won't have gotten anywhere if all we are talking about and all we are thinking about is what's happening inside the shelter. So resources are, of course, going to be a key issue in any of this. And that's why we need to make sure that we're developing a message that's going to resound, and not only work for our current supporters, but help us build that public policy, and help us build more support to a much broader audience than just people who are our current supporters. And I think the other major sort of obstacle to any of this is organizations confronting their own internal mindsets about what their mission is and about what they do, and their mindsets about their community and the role that they play inside of their community. I can't tell you and the number of animal welfare leaders that I've spoken to that have nothing good to say about their community. And I get it, right? Sometimes I feel that way. So because we get to see some really rough things, like we get to experience parts of our area that nobody else does, and it can be hurtful, and it can really change our perspective, our community. But we have to be willing to move beyond the worst that we see and realize that that's not our community, right? That's just
Right.
that situation. And then we need to focus more on the good that we can do.
Yeah, and I think you really hit it earlier when you said that the 90% is an easy message. It's really simple to communicate to people. And one of the challenges that I see is just that people don't expect anything more from us. Like we've been able to, in at least here in Austin, we've been able to do more than that. We've been able to do the 90% at least, but the community doesn't understand all this, and our policymakers don't understand all this, and even people inside the shelter don't understand that there's a whole other world that needs to be addressed in terms of human problems and their effect on animals, and how do we more humanely work within our communities. It's a lot harder to do than you would think, and I honestly think it's because we have decades and decades of doing of creating walls around our shelter services and our hearts and our work that protect animals from people. And so, all of a sudden thinking of people as part of who we help is it's really a lot harder than it seems to turn the ship around, and get everybody going in the same direction.
But it's that people aspect is so important, and that's what we've been missing. It's very rare that an animal self-admits themselves to the shelter. We don't have dogs and cats who just, I'm sure we have stories where some have shown up, but in general, they don't find their way to our front door on their own. Every pet in our care is there because of some sort of human struggle or failing that occurred prior to their intake or ever coming into the shelter or getting into an animal control truck. Shelters have problems, right? Many shelters have a lot of problems, but shelters are not, and they have never been the problem. They're not the issue. Shelters are simply a bandage over a large wound, and we can change that bandage. We can get better bandages. We can go take classes on the best practicing for bandages. But if we truly want to stop bleeding and we want to heal the damage, we have to get the patient to surgery. Right. We can't just keep changing the bandage. And that is what we're doing if all we're focusing is on that save rate and what's happening inside the shelter. We've got to get the community, we got to take this patient to surgery and stop the bleeding. And the bleeding's not inside the shelter.
So let's talk about that. Being a person myself, and you all being people, we know people have a lot of problems. All of us do, no matter what our background is. But one of the great things about the Human Animal Support Services Project is that a lot of our work in the industry and with the industry professionals that we work with is all about helping people and understanding that people have problems. Talk to us a little bit, you both of you, about how you see people problems impacting um, people and pets in the community, and what those people problems and maybe kind of lay out some of in general what some of those people problems are that you see.
Uh, I mean, I'll go.
Okay.
No, we have the same people problems that are affecting every other social service, right? So we're dealing with food and housing insecurity, economic struggles, access to care issues, just bad laws and policy. That's why our animal shelters are full. That's why we're euthanizing. That's the issue. Those are the reasons that we are in crisis. Are there shelters out there that are being poorly operated and unnecessarily euthanizing? Yes, there are, right? And too many. And we need to continue to address those issues and address those as they come up and deal with those. And should they be pressured to improve? Of course. But if we want to solve the broader issue, we can't just focus on the sheltering. The work to improve sheltering should continue. We've done amazing work under this movement to make sheltering better, and we should be proud of that. But unless we address the root causes, we're going to continue to struggle. And honestly, something that we don't talk about enough with this is the human damage that can be done by hyper focusing on the save rate metric, if that's all we're talking about. And this may not be popular, and this may be a slightly uncomfortable thing to say. And it's hard for me to say because I have seen myself reflected in this very statement. But so much of our save rate and even some of our, a lot of our no kill history is rooted in saviorism. And that has taken places and divided them into good and bad based upon their no kill status. And if you were to take something like, if you were to take like a no kill status map and you overlay that with economic and diversity data, you're going to see some pretty stark patterns in areas that have seen improvement based on this metric versus ones that haven't. And it's, why is that? That's something we need to address. Is that the equity and equality issue? Why isn't this movement that's based on save rate? Why hasn't that spread equitably through around the country? And there's got to be a reason there. There's things we need to look at. Could it be that the save rate obsession has small, poor communities subsidizing pet ownership for wealthy communities through the transport programs? That's happening every day. What if that money that these poor shelters are pouring into their transport programs were instead invested in building community resources that address the root causes? Or better yet, what if we're able to help that shelter do both things at once? Imagine that, two things at one time. Increase your save rate and build community programs. But we have to find new ways to talk about this, and we need to be honest and introspective about how we have gotten to where we are.
Yeah, that was really well said, Cole.
Yeah.
We've got a problem in our industry, and we're, I think we're all in reactionary mode where we feel like we have to choose one thing or another, and it's not fair. Like none of us should be in that position to have to choose to save an animal life or help a person, and we've got to figure out a way to do better. And I think not only does that mean that we need to build the programming that is out there that would be helpful to people, but also we need to look at ourselves and and I know we talked about this a little bit earlier, but just we kind of have a refusal to look at animals as connected to people. And one of the things that I've seen in sheltering is that there's a strong desire for shelter workers to want to work with animals and not people, and they get into sheltering to avoid people. But I've never met an animal that doesn't have people attached to it, a person attached to it. And for so long, in the work that I do, I've been thinking about that as the volunteer that's attached to that animal, and the feelings they go through if that animal is a long stay or it's being euthanized because of bite or something. Or the foster home that has put their heart and soul into a distemper dog that then dies. And how do we support them, or even the staff person that is having to watch animals languish in the shelter. But it's when we start thinking that there's so many more people involved, you know, the animal comes to us and they may get attached to a human in the shelter, but they've already been attached. Unless they're newborn babies, they've already had somebody else in the community that we are just ignorant of. And I think it is our job to figure out how to do both, how to help the animal and the people in the shelter, and help the animal and the people outside the shelter. And to really, like, to your point, to not look at it as saviorism, but to look at it as our job. It's our job. And we should be advocating for the resources to do the work that is necessary to have a humane community. I'll say one thing that I think I heard today that is just astounding, and I don't have the research behind it, so we'll have to figure out where this lives, but a colleague said that there are more children in the United States that live with a pet than there are children living with a father. And that's fascinating, because when we're trying to communicate how important it is to be working with our community, a nugget of information like that is critical, because it's opening doors that nobody else has access to. As like the animal door has access to so many people that need help and could use resources or a leg up or whatever, strengthening the bond, and we're ignorant of it.
Yeah, I mean, thank you so much for that answer, and I'm sure the two of you would agree that starts at whatever piece of outreach the shelter does, whether it's the animal service officer that's out in the field, going from call to call, or whatever the shelter is able to do in the community.
Can be, I mean, and that's,
So,
you know, starting, and just, I mean, starting community programs
yeah,
can be simple. I
Mhm.
mean, it can be simple of, you know, as you may have a lot of dog houses in your back, in the back, stored somewhere, and start giving people dog houses, or if you have extra food, start giving food, or find a veterinarian to see if you can do a quick vaccine clinic, or just, you know, start small, start those relationships small. It all seems daunting, right? And this whole shifting what we're doing just seems like, oh my gosh, how can we do that? But we did it up here, you know, in our small shelter, and it just started by doing little things, improving your work to the community. Then the community is going to start supporting more of those community programs themselves, and they'll start to grow.
all right. Um, so my next question is, how do you suggest broadening the definition of success in sheltering to encompass the welfare of both animals and the community at large?
I mean,
Well,
that's,
yeah,
oh,
go
go ahead,
ahead.
Ellen, go ahead.
No, go ahead.
I mean, I mean, that's the $1 million question. And I think that's one of the things that we struggle the most with. I mean, that's the advantage of save rate, is that we have an established metric. We know it's division, right? It's two numbers, one divided against another, easy to figure out, easy to label. We have struggled to try to figure out the measure impact of community programs. How many, you know, how do we turn pounds of pet food into lives saved, right? If that's what we're trying to focus on. And so that's what we have to give a lot of thought to, figuring out how we're measuring this, what that means. And, you know, I don't know. But we have to figure out ways to quantify our impact to people and communities, so that we can show our worth and advocate for additional resources. And I think a save rate is important. That save rate is a part of that. I don't think anybody is saying that we no longer consider that and no longer think that that is it's a very important number
Yes.
that should always be a part of this larger equation of what moves us forward and what we're trying to do as an industry. It just can't be the only number.
Yeah, and I've thought for a long time that shelters, and I don't know the history of human hospitals, so this is kind of going out on a limb, but I think that back in Florence Nightingale days, that human hospitals were, you know, not didn't didn't have a very robust reporting system. And over time, more people cared about that, and more people wanted to see better outcomes for people that were coming into human hospitals. And so you may, nowadays it would be as absurd as a hospital only reporting the number of surgeries they do. But really, they have extremely broad metrics, and I actually looked them up this morning in preparation for this discussion. But they actually, their ratings are based on mortality, safety of care, readmission, patient experience, and timely and effective care. And and that's just inside the hospital. When you start looking at how they measure the health of the community, which directly impacts the hospital's staffing and hospital funding and hospital, the types of doctors they have in those hospitals, it's much broader. We don't have any of that rich detail. And it's kind of a self-perpetuating system, because we only have so much data at our hands, and we only have we're reliant on software that is not built to look outside the community. And so we really need to, and I know software companies are thinking about this as well, but we need to keep pushing. We need to keep pushing for metrics that tell the story, the whole story. And I know we talked about it a little bit earlier, but the elected officials really do care about what's happening in their community. They may not care about 90%, or they may not care about the shelter as the sort of dumping ground for disposing of animals. And I don't mean by the people that own them, but just in general, that's what they're looked at, as sort of like the garbage collection. And if we can better communicate what we're doing, then we can get more dollars, and we can get more attention. But right now, we don't have the resources, and there's not even a standardized, I know, thankfully, programs like SAC are trying to pull together data across the country so that we can see what's happening at least some level. But we really need to get a lot deeper. We don't know why all these animals are coming in. We're building the intake data set with Haas, and we're hoping to have that out pretty quickly to shelters. But we need a lot better information to be able to communicate what's actually happening in our communities and in our shelter, to be able to garner the trust and support that we need from donors and policymakers.
Thank you for that. And I think that answered all of my questions. We
Wow.
have 20, I know, we have 21 questions in the chat, in the Q&A. So
Okay.
we are going to get through all of those, and reminder to be concise with your answer, but also please put as much detail in as you think is necessary to answer the question. The first one is from an anonymous attendee. Can you please explain the analytics of 90%? How did we as an industry come up with that number? And was there science behind it?
I want me to do that one. Okay.
Yeah.
So there's a lot of history behind it, and I think it was promoted by Nathan Winograd and San Francisco SPCA way back in the day, and as one of the first shelters or communities that reached that 90% threshold, large communities that reached that 90% threshold. I can tell you that we didn't know what we were doing. We had no idea if that was the right number or not. There was it appeared to be a guess. And I think that in our work with American Pets Alive, we have worked with a ton of shelters, and specifically had our leadership masterclass through the Maddie's Leadership Academy, where we would ask people to bring their data set and bring a month's worth of animals that were euthanized, and bring their entire files, because you can't see it in the database. You can't run a report on what's actually going on with that animal. And we would put them in different categories, like read their records, put them in different categories, and actually find the real reason they were euthanized, and then start trying to bucket that out. And across the board, it was way over 90% of their shelter population that was treatable, manageable, and adoptable. And I'm not even talking about trying to address some of the behavior challenges that we have here in Austin, or some of the severe distemper cases and severe medical cases that we treat at Austin Pets Alive. This was just simply getting to 90%. So I believe that it is a good metric, and I have yet to see a shelter that is incapable of reaching 90%. We are, I hear often that if we are taking in fewer animals, then we should get to a point where they're all really challenging, and that means the percent of animals that are savable is going to go down. I can tell you, as an organization that only takes in animals that are extremely challenged, we're still at 90% live release rate. So I think it's a pretty good number, but it's a blunt instrument. It doesn't give us the detail. The fact that you have to read a stack of records this big to understand what really happened to those animals one by one is ridiculous. We have to be able to look at this more clearly. And in the long run, it's probably not going to be the right metric, but for now, I believe it is.
And I also saw that John Fisher put in the chat Asilomar chords, which those of us who have been our dinosaurs, we remember the Asilomar chords. So if you ever want to Google that, we don't have time to go into that now, but that is very interesting reading. All right, Colette Resnikoff asks, she starts with a statement. Dr. Pisano from Team Shelter USA focuses on length of stay to shift the focus to adoption and foster effectiveness. When she did the study for San Marcos Regional in Hayes, has that feasibility study been looked at?
I've read it. I don't know if that was the purpose of the question, but length of stay is a good indicator, as long as it's not used as a punishment, in my mind.
Yeah.
Length of stay is important. It's like bed turnover in hospitals. It's critically important to manage it correctly and to move animals out just like you move people out. But people don't leave as a space euthanasia out of a shelter, out of a hospital, because they need the bed. They figure out how to start doing home care and get them out the door. And so we need to keep focused on those with length of stay. As long as it's pointing us in a positive direction, I feel like it's a pretty good measurement to be looking at as well.
Yeah, and I think length of stay is a very important measurement, and it just gets, that speaks to the complexity of us trying to quantify something that's so complicated under one number. Prior to when I came to Good Shepherd was no kill, 90% plus average length of stay in the years, and now we're the same basic release rate, save rate, but we have a length of stay of a month. So according to our save rate, we're just as effective before the change and after the change. But the truth is, we're now 3 times more effective. But that measurement doesn't capture that at all. And somebody should have been on, they shouldn't have been able, previously, we shouldn't have been able to lean on, we're doing no kill, but we're only moving 100 animals a year, right? When we should be doing 300. So, that is definitely length of stay, quality of life, enrichment. All of those things need to be included in what makes for a healthy, humane shelter.
Yep. All right. Next question. Meredith Bruder asks, save rate is a very easy number to manipulate. So how accurate do you feel this is?
I think in general, and I'm sure that there is number manipulation going on. I think in general that people are probably relatively honest in their reporting, if they're reporting, right? But we don't even have to have reporting. Like, that's not mandated on a national level. And so even the definitions of what save rate is, may be different depending on what shelter you're sitting at or what organization you're working with, or whether it's save rate versus live release rate, whatever. So yeah, of course the data can be manipulated. There's no standardization, which is why we have to look at this deeper and get better, and start like hospitals and start having standardized data reporting and what means what, and expect that from everybody.
Yeah, and I think that the fact that it's a number that is based on ourselves is kind of silly too, I'm going to keep harping on hospitals just because it feels relevant. But when you look at mortality rates in hospitals, they're basing it on on the professional and scientifically drawn mortality rate for heart failure or heart attack. And then you're looking at how your shelter's doing compared to that, or your hospital's doing compared to that, not how you're doing against yourself. There's, you know what I mean? And so it's just another flaw. But we already know it's a flawed system. It's better than nothing, but we've got a lot of work to do.
All right, we have another question from an anonymous attendee. Why does it seem like our focus is about the save rate and not educating the public on spay, neuter, and providing access to care?
Go ahead.
It's a lot easier to communicate. I mean, it's easy. And it's a compelling, like we've talked about before, it's a compelling number. It's life and death. It pairs well with ad copy and raises money and awareness for animal focused people. I mean, it's a successful metric in that aspect. But it's harder to explain spay neuter. It's harder to explain access to care. It gets into all that sticky human stuff that we're not used to talking about. So we keep falling back onto, save rate, save rate, save rate.
And I would argue there is a lot of communication about especially spay neuter. I think it is probably, if you ask any human being out there on earth what people need or animals need, they'll say spay neuter. So I think it is adequately discussed. I think that connecting the two dots is an important piece of the puzzle that we're not very good at. Other than talking about spay neuter decreasing euthanasia in the long run, right? I think the community grasps that. But how do you run the hospital at the same time as have the preventative health program in the community? How do you do both together well? That has yet to be achieved.
All right. Next question is from Casey Balicki. With the push of the no-kill movement, do you feel like there is a misconception or a lack of understanding over what that means and how it correlates to the live release rate?
I mean, I will say that, is there a broad misunderstanding of what no-kill means between what we understand no-kill versus what the public understands as no-kill? Yes, 100%. We understand that running a responsible, humane, no-kill shelter does involve euthanasia, that there are cases where that is necessary and required, either to alleviate suffering or for community safety. But the public is still surprised when we say, sometimes we do have to euthanize. No kill doesn't mean just sticking them in a crate and stacking them up. So yeah, I think that there is a lot of misconception of what that means, which in some cases it's good because it encapsulates this sort of idea of you don't euthanize for space or whatever, and people get the kind of get the general point. But when it comes down to the details of what we actually do, it leaves a whole lot out and people don't understand.
Yeah. Agreed.
Nice. All right. Gina Latuka, her question, and she started it with a little bit of a long example. We are a licensed humane society, and while we do not euthanize any owner requests for behavior reasons or old age with no other problems, we do offer euthanasia service to pet owners for pets who have sadly reached the end of their lives medically. Since no kill became a phrase, we have struggled because metrics do not seem to acknowledge this very important service for pet owners and suffering pets who cannot afford veterinary services. Is this a common hurdle, and why is the necessity for such services frequently ignored when establishing no-kill designations?
I can try to answer that. It's a hot topic for sure. I think that it is a necessary service, and but I think what is missing from the picture and why it gets so much heat from no-kill advocates is that there's not, if you don't offer an alternative to those people for their pets other than death, then they may feel like they can only choose death. And so if it's all that can be offered, potentially bringing the animal into the shelter and trying to understand if they do have any life ahead of them is better for the animal. The but as my hope is that as shelters progress, that they actually are able to offer more than just euthanasia services. If you have a person who can't afford medical care for euthanasia, they probably can't afford medical care for the condition that is leading them to euthanasia. And it might be something very treatable that we deal with all day long in our shelters. So in my mind, it's important to not segregate out just because the owner said they're ready to euthanize, then from our critical thinking about what is possible for that pet. And I mean, I'm a veterinarian. I've worked in private practice. I've done that as a private practice veterinarian, euthanized on demand. And it has left some real scars. And I think we need to be aware of what we're doing.
Yep. All right. Next is from an anonymous attendee. There seems to be so many formulas for save rates or live release rate. Is there a standard formula so we know we are comparing apples to apples?
No,
Go
there's
ahead.
no standard anything. That's one of our big problems. We need standards. Because in some metrics, owner requested euthanasias are counted, and that some metrics they're not. And sometimes it depends on who you're grant reporting to or what your state requires, and that is one of the problems with all of our data and everything that we're trying to measure, is we don't even have a common agreement on the basic ones.
Yep. In one of my shelters, we published 4 different formulas. It was a Silomar, live release rate, save rate, and a fourth formula that I can't remember, but yeah, there is no standardization. All right, Jen Colby asks, do you have any good examples of partnerships with social services and housing advocacy organizations? Loss of housing or restrictions is a major factor. These are major factors, yet often are siloed and not something most shelters work on. Personally, I've volunteered with low income advocacy and community organizations too. Frankly, I've found it easier to advocate for the animals than my fellow humans in need.
Well, I mean, I think that there's a lot of emerging partnerships out there, and there's some great groups. And I know Haas has some pilot shelters that have been doing some amazing work with social services. And now we're even seeing, animal housing in domestic violence shelters and housing shelters too. So that what shows us that the human side of social services is recognizing the importance of this. We provide food to all of our food banks and to our shelters here, and it's done amazing relationship building. But we're seeing more and more of those partnerships emerge, and I know there's some great Haas models and programs for that.
Yeah, there are, and we have several shelters that we can refer you to if you email us. We have like a shelter in Pima County Animal Care and Control that has a One Health clinic that they go out at social services. And we have several of our shelters that do that. Oakland Animal Services does that as well. There are some partnerships out there, and that's what our project and our work with all of you is all about. And especially this year, you'll see that too. Um, All right.
I'd like to
Yes.
add to that too. I think
Yes.
one thing that you can do to partner is to ask, is to go to your local housing advocacy group and ask them to
Mhm.
ask questions about pets. Just even if they did like a pet week where they did 1 week of putting in all of their forms of people asking for services, asking them if they have a pet. Sadly, that's missing from most human services questionnaires. And having data is the most effective thing you can do to get the support you need at a legislative level or at a local policy level, even at a donation level. And so that's one thing that I'd recommend doing. You can also use, if you go to the Haas website, the pets.findhelp.com is a resource that can be put on websites, and it starts to gather information about what services people are looking for that have pets. And that's another data source that can be incredibly helpful for building those partnerships. It's really hard to walk into a human services organization and advocate for helping pets at the same times as people if they are if they think it's just a small problem, when we know it's not a small problem, but we don't have data to back us up.
All right. We have time for one more question. And if you could change 2 or 3 laws or policies with the snap of a finger to save more animals, what would those be? Best practice, local or state laws?
Well, I would instantly change every law to give our field services teams lots of discretion in their work. No mandatory impounding. Uh, let the officers, just like we let police officers have a lot of discretion in their work, we should allow all of our field services officers dealing with animals to do the same. And yeah, and then I would just move us over to human services and make us a defined and required part of the human services world inside of in this country.
Yeah, I agree with that. And I would add one that is particularly on that housing issue, that there's so much public housing and locally funded housing that is that has pet restrictions. And I would make it illegal for any kind of publicly taxpayer funded housing to have pet restrictions. That would be a big, giant help.
Yep, that would really would be. I'll just add that I would definitely have laws in place that protect the pet owner. And whereas now it's you must issue a citation or you must impound the animal, um, laws that require shelters to provide services and information and access to things before they take any enforcement action. All right. Well, we are at our time. So, wow, this has been great. I'm wondering if so we have 18 more questions, and I'd love for us to get answers to our audience. And so we'll work with the panel to make that happen and to get the answers back out to you all. Because I know Dr. J wants to answer the questions, and I know Cole does too. So I didn't even have to ask them that. Okay, all right. So thank you once again. Let me read our outro, which is everyone. Thank you for joining tonight. I really appreciate all you being here, and the respectful nature of the chat was incredible. There was so much good information in the chat. I think that was the richest chat that we have had, with so much information and so many knowledgeable people. Uh, Remember the Human Animal Support Services Project. We always are looking for ideas and for collaboration. So please continue to contact us. You will be seeing us out at more outward focus this year, whether it be through new working groups and also through our job alikes. So please go to our website and sign up for those if you are interested. And then we will also be sending things out to recruit more of you to be part of this movement. Our next webinar will be on March 14th, featuring the Competitive Pet Placement Project, one of our major projects from last year. My team will share a registration link in the chat. Plus, keep an eye out in your email. Thank you for being here tonight, and I will see you again soon. Thank you, Dr. J and Cole.
Thank you. Thanks for having us.
Thank you.